Welcome to Season 1, Episode 5 of the Home Healthcare Today show. Today, our guests are from the Michigan Parkinson Foundation. We will be joined by the current CEO, Ms. Mary Sue Lanigan, and also joined by Dr. Edwin George. We're going to dive into what Parkinson's disease is, right? Take on some of those questions that viewers and listeners often pose as related to the illness. But first and foremost, let me give you a little background on our first speaker, which is Dr. Edwin George. Dr. George joined Wayne State University School of Medicine in 1996. He is the director of the Wayne State University Movement Disorders Center and the director of Movement Disorders Clinic at the John D. Dingle VA Medical Center. He was chairman of the Professional Advisory Board of the Michigan Parkinson Foundation, and he serves on the Movement Disorder Strategic Planning Committee of the American Academy of Neurology. He was also former board chair of Michigan Parkinson Foundation. His current research focuses on MRI imaging techniques to visualize the progression of Parkinson's disease in the brain, which is useful for assessing new therapies. We are also looking at functional MRI changes related to hallucinations and memory problems in Parkinson's disease. Dr. George is an associate professor of neurology and a fellow of the American Academy of Neurology. Dr. George, welcome to our show.
Thank you.
Dr. George, do you mind elaborating a little bit more on your background as well as your passion for Parkinson's disease and research?
Okay, well, in your introduction, you keep mentioning movement disorders, and movement disorders are one segment of neurology and actually encompass a number of different diseases. Some people have heard of Tourette's and
Yes.
people with tics and involuntary movements. Some people have heard of dystonia, where people have sustained contractions of parts of their bodies. But one of the most important areas in movement disorders is Parkinson's disease and Parkinson's-related diseases. And in fact, the majority of the patients we see have some form of Parkinsonism, and the vast majority of people with some form of Parkinsonism actually have Parkinson's disease. Mm-hmm. So Parkinson's disease is a really important area in my clinical work. It's also one of the more common neurodegenerative diseases out there. After Alzheimer's, I think it's second. So, it's a great area to be in these days. When I first started working with Parkinson's, there were only a few medications, and some of them going back to the 1960s. And the number of medications and treatments and things we can do for people with Parkinson's has really blossomed over the last several decades. And we can keep people much more functional with Parkinson's than we ever could before. And we always believe we're closing in on some form of cure for the disease. Yes. So it's been a really exciting time to work with people with Parkinson's.
Absolutely. Yes, sir, Dr. George. And when many people are first familiarized with Parkinson's disease, it's perhaps by way of a diagnosis or a family member or a loved one is diagnosed. And then there are those really popular cases of Michael J. Fox, for example, and then the late Muhammad Ali. And you mentioned, Dr. George, that there has been developments over the last few decades and hopefully moving closer to a cure. Do you mind, sharing with the audience some of the common treatments as well as therapies or interventions for Parkinson's disease?
Okay, so the first thing, the movement part of Parkinson's disease happens because you lose nerve cells in the brain that release a brain chemical called dopamine, which is very important in regulating the other parts of the nervous system that generate your movements. And in fact, as research has progressed, it's more and more clear that your brain actually formulates a program to drive the movement before you make a movement. And the dopamine is really a key factor in that regulation of how you generate the program for how you're going to move before you move. Yes. So a lot of the treatments have been medications that help the brain make more dopamine even though it's losing these nerve cells, medications that help the dopamine that you've got to work and to keep the levels up in the system. So those are the basic treatments from a medication point of view, but there are also medications for other sorts of symptoms because Parkinson's disease affects far more than just your movements. So there's a wide variety of medications to work on that. But also very important are things like physical therapy and activity. And in recent years, there's been more and more research showing that exercise and physical activity are very important in keeping people functioning with Parkinson's disease and doing well in their life. In addition to that, balance is a big issue as Parkinson's disease progresses, and falls are one of our big problems that we have to worry about. And so there's a lot of physical therapy and treatment around trying to maintain balance. Yes, and then having mentioned these therapies and mentioned the mainstay of the medications, we also have to talk about that there is surgery. Yes. Which primarily what we do is called deep brain stimulation surgery. Okay. And that involves actually implanting some electrodes in parts of the brain that are very affected by the altered neurochemistry, and so the circuits don't work the way you want them to. And a pacemaker, just like a pacemaker for your heart, yes, is implanted and attached to these wires. And by stimulating certain areas of the brain, we can make the circuitry of the brain function much more the way it normally would, yes, if it had enough dopamine to get by. Wow. And some of the latest things with that, the devices now monitor the brain waves in the area where they're implanted and look for certain frequency patterns and can adapt the stimulation to respond to what you need at the time when it's actually being active, as opposed to before we would try and get it programmed and it would just run right the same way all the time. So
wonderful, Doc. Those are some major advances in the sciences as related to treatment. I did hone in on some of those major points you made about physical therapy and exercise and movement, and then the more elaborate or more exhaustive being the surgeries that you discussed. So, doctor, is there such thing as, I guess, prevention or self-maintenance? Granted that only a small amount or a small percentage of people, of the 1 million or so people in the United States who have been diagnosed with Parkinson's, less than 4% are diagnosed prior to the age of 50. So from your experience as well as research and knowledge, are there preventions?
Well, unfortunately, we can't really prevent Parkinson's any more than we can cure it at this point. Yes. We've come to understand more and more about how it gets started as an abnormal processing of proteins in the brain. Yes. And it turns out there are quite a few different ways that process can get triggered. Okay. And it probably does get influenced by some chemical exposures, but most of them are, there are chemicals known that can directly damage the dopamine-producing neurons, but they're not things that most of us run into in day-to-day life. There are some things that some people chronically exposed to some of the herbicides and things used in farming seem to have a higher risk, though it is an interesting combination. You have to have a genetic susceptibility and then be exposed to those types of things.
Okay.
But most of the time, the triggers are not things that we can put our fingers on at all. And like I say, there seem to be quite a few different ways the processes can get started. Nonetheless, a healthy lifestyle
Yes.
and good nutrition, good exercise, and so forth. If they can't prevent you from getting it, they can help to make sure that you have the best possible life during the time you're affected by it. So.
Yes, sir. And you mentioned genetic susceptibility, and we know genetic susceptibility is non-modifiable. But to your point about exercise and activity, those are modifiables.
Yes.
Yes, sir. So, Doc, with that being said, as a home health care agency, we do help plenty of patients in the Metro Detroit area who have been diagnosed with Parkinson's, and some are in more of the advanced stages of Parkinson's disease. What are some things that I guess families or caregivers could do in a home setting to assist a loved one who has Parkinson's disease?
Well, there are a variety of things that become important. I mentioned how big a problem balance becomes as Parkinson's progresses, and just one of the things we're always advising people, you want to have an uncluttered place. You don't want to have throw rugs and things you can trip
Right.
on. Be careful about wires running across the room, things like that. So you can make sure your home environment is a safe place for someone who has balance issues. And then, of course, we go to things like the bathroom is like the most dangerous place in the house, and putting in grab bars and things like that so that people don't lose their balance and fall.
Yes.
And then sometimes people, get to the point they need assistance in terms of dressing and doing their activities of daily living.
Yes.
And of course, family and caregivers are very important with that sort of thing. And also patients themselves. I start trying to coax patients early on. You spent your life, you grab your pants, you step in with one foot, you step in with the other foot.
Yes.
When your balance gets worse, you need to sit down and put on each foot and then stand up and pull up your pants, or you're going to find yourself hopping across the room and falling on your face sooner or later. And you need to develop those habits of how to avoid getting into potentially dangerous fall situations.
Yes.
Once you know you've got the disease before it's actually a problem. And families can help with that too. So.
Sir, and those activities of daily life,
Yeah.
the dressing, the eating, mobility, bathing, and toileting, right?
Yeah.
And family members being able to provide support to loved ones, as well as physical therapists,
Yeah.
that could come in and help with balance and help with strengthening, gait strengthening.
Yeah. And you mentioned eating. One of the things, now this gets to very late Parkinson's.
Yes.
Many people do very well for a decade or more
Yes.
with Parkinson's, but swallowing problems can be an issue, particularly in later Parkinson's. Also in some of the less common Parkinsonian diseases that aren't true Parkinson's, you get more swallowing problems. But family members should know how to do the Heimlich maneuver,
Yes.
because you don't want to have somebody who's choking and not know what to do about it. So.
Absolutely, Doctor. Great point. Great point. So, Dr. George, as we wrap up the clinical portion of our interview here, what are some of the resources, clinics, as well as specialists that you would recommend for viewers and listeners in Southeast Michigan to consider?
Well, of course, most of the major health systems have a movement disorders clinic. Many people with Parkinson's won't be able to see movement disorders specialists at least regularly. Everybody who has Parkinson's, many people are diagnosed by a primary care physician, and that's great, but everybody should see a neurologist at least once or twice, first to make sure that you do have the right diagnosis. Not everything that causes a tremor is Parkinson's.
Yes.
Not everybody who has Parkinson's has a tremor, only about 2/3 do. So you want to make sure you've got the right diagnosis, and then later as the disease progresses, because we have so many more medications and treatments, it's important to see a neurologist who really knows their way around the medications. And of course in Detroit, down Wayne State Neurology staffs the neurology clinics at the Detroit Medical Center, and Henry Ford has a great neurology program and some movement disorders specialists, and of course University of Michigan does. But there are a lot of other physicians out there in the community and so forth. And of course, I'm prejudiced, but the great resource that we have that a lot of places don't is the Michigan Parkinson's Foundation, which works throughout the state, but is centered here in the Detroit area.
Yes.
And I think if you go on the website, you can find a list of doctors with expertise in Parkinson's. I know we used to field phone calls, and we would give people at least 3 different names in their area of physicians that they could see.
Yes.
And also we have things like the Rehab Institute of Michigan. And again, physical therapy and rehab, and the major health systems all have physical therapy, speech therapy, and so forth. And those are very important resources to take advantage of in Parkinson's disease.
Awesome. Dr. George, we appreciate all of your contributions to science, to research. Yes, sir.
Forgot to mention, because I myself spend a couple afternoons a week, as you know, over at the VA hospital.
Oh, that's my hook.
Oh, okay. But yeah, if you are a veteran, the VA can provide all sorts of very good services for people who are entitled to VA services. So you definitely don't want to overlook that if it's an option. So.
Wonderful. Yes, Dr. George, that was definitely the hook I was going
sorry.
No, you're fine. No, we can share the thunder and the lightning. It is very good that you continue to contribute your research as well as teaching to Wayne State University, your civic service and commitment to the Michigan Parkinson Foundation, and definitely to the VA, Dingle, the VA hospital in Detroit, to help our veterans who have made that ultimate sacrifice to protect our civil liberties. So we commend you and honor and respect you for all of those contributions.
Well, thank you
very
much.
Indeed. Yes, indeed. So that's Dr. George. Great job today. I'm sure our listeners and viewers have been informed, enlightened, and of course inspired to move in a positive direction as related to Parkinson, the Parkinson disease, as well as research and a better understanding. Thank you, sir.
Thank you again.
Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long Once again, welcome to Season 1, Episode 5 of the Home Healthcare Today show. For those of you who are just tuning in, we are visiting along with our friends from the Michigan Parkinson Foundation today. They've decided to come on into the studio so we could have a great conversation, because granted it's April, and April is Parkinson's Awareness Month. In our earlier segment, we had a great conversation with Dr. Edwin George of a clinical nature as related to Parkinson's disease. We're going to shift gears now and have an interactive dialogue with the CEO of Michigan Parkinson Foundation. Once again, Michigan Parkinson Foundation is an organization that has direct patient services, provides direct patient services and education to people living with Parkinson's disease and their families. Michigan Parkinson Foundation is located in Bingham Farms, Michigan, but serves patients and clients all throughout the state of Michigan. The current CEO, Mary Sue Lanigan, has been with the foundation for 4.5 years. Prior to that, Mary Sue was the development director for the Arthritis Foundation, Great Lakes region, for over 15 years. Additionally, she was a patient educator at the Cleveland Clinic and community education director at the Diabetes Association of Greater Cleveland. Mary Sue has 31 years of experience in program development for chronic disease management in both the nonprofit and the private sector. Mary Sue holds a Bachelor of Science degree in community health education from Kent State University. Welcome to our show, Mary Sue.
Well, welcome. Thank you for having me.
Mary Sue, you have a very impressive background in both the private as well as the nonprofit sector. I'm glad we were able to win you over to Michigan from the Buckeye State of Ohio. So please share with our listeners as well as our viewers a little bit more about why the Michigan Parkinson Foundation and your passion for the mission of the Michigan Parkinson Foundation.
Well, you mentioned, I started there about 4.5 years ago, and what really attracted me to this position is we are independent. We are headquartered in Michigan. Our charity was founded in Michigan. We're not part of a national organization. So if our medical advisory board, we have a phenomenal medical advisory board comprised of neurologists and healthcare providers throughout the state. If they see a problem that people with Parkinson's are having, yes, they can bring it to us. We address it. We say, yeah, let's fix this. Let's help this person out. Mm-hmm. And we can make the decisions here locally. We see a problem. We come up with a solution, and we can implement it ourselves. So we don't have to go through a lot of bureaucracy. We can make it happen. Wonderful. That was what really attracted me to this position.
Yeah, so being able to be hands-on and mm-hmm. do some things to provide some positive impact for Michigan residents. Wonderful. A little bit more about Michigan Parkinson Foundation. How about history, what you view as the vision, that you and the board and your executive team have for the foundation, and what would be some good milestones as you reflect upon your role?
Well, the foundation has evolved quite a bit. It was founded 38 years ago here at I believe, the Detroit Medical Center by a doctor, a neurologist, Dr. Robert Bauer. He found that once the doctors would give a patient the diagnosis of Parkinson's, it would be pretty devastating. They'd get the diagnosis, they'd get a prescription, they'd go home, and they'd be, now what?
Yes.
And there wasn't a lot of patient education material out there at the time. So the foundation was established to provide education and support to people with Parkinson's. Mm-hmm. And they initially started delivering patient education programs on how to better manage Parkinson's. As Dr. George mentioned earlier, the most common symptom that is associated with Parkinson is a tremor, yes, along with stiffness, rigidity, balance issues, and those are considered motor symptoms. But there's also a whole slew of symptoms called non-motor symptoms, and they kind of sneak up on people, and they don't realize, oh, that's Parkinson's. Yes. And so an education program was developed to teach people how to live better with Parkinson. You don't die from Parkinson's. There's no cure. Yes. It's progressive. It gets worse slowly over time. So you're going to live with it for a long time.
Yes.
So the foundation was established to help people live better with Parkinson's. And initially, as I said, they started out with education, and then they found the value in support groups.
Wonderful.
So they started establishing Parkinson's support groups here in Detroit. And a significant milestone would be we now have 76 Parkinson's support groups throughout the state of Michigan, and including 5 of them in the Upper Peninsula.
Thank you, Mary Sue. And that was where I was headed to with that positive impact that the Michigan Parkinson Foundation has on its stakeholders. So for those that may be a little reticent or reluctant to reach out to a support group, do you mind identifying some of those benefits of reaching out to others who have been challenged and struggled with the disease?
And we hear that a lot. People are private. They don't
Yes.
want to talk about. It's like,
Yeah.
I got this.
Right.
Nobody needs to know. Don't be telling. We
My
hear,
business? That's
we
my business.
hear husbands tell their wives, don't tell her that.
Right. Yes.
You go to a support group, and more men have Parkinson's than women. I think it's like 66%
Right,
of the
1 point,
population
yeah.
are male versus women.
Yes.
And when you go to a support group and you see, there's probably about a 20-year age range of maybe
Yes.
people are between 55 and 75 or 60 and 80.
Mm-hmm.
And you start talking about just various topics. People can relate to it. They're like,
Yes.
oh, yeah, I have that problem.
Uh-huh.
And you can learn more from other people who are
Yes.
dealing with the same problem that you are dealing with than reading about it on the internet, or maybe your doctor did tell you, but you're so shocked you don't hear it all or you don't take notes.
Mm-hmm.
And just practical solutions for activities of daily living.
Yes.
Just a sharing of knowledge, and then they develop friendships. And the support groups become a very, very important part of their life. It's also an important part for what we like to call their care partner, who's very often their spouse or maybe a family member.
Mm-hmm.
That care partner meets other spouses that are taking care of a loved one,
Yes.
and they can share resources and information. And we try to help them by bringing in speakers on various topics, or so it's we call them our boots on the ground educators. They are the people in the community who are helping to educate other people with Parkinson's. They also know the community resources that are available.
Yes.
So it's just a valuable program. One thing about COVID,
Yes.
our groups have not been able to meet in well over a year.
Right.
And as more people are getting vaccinated, we're hoping that most of them are going to start up meeting again this June.
Yes.
Because of the age of our people with Parkinson's, most of them we're thinking have probably got vaccinated. But we've been meeting every Tuesday night on Zoom. We
Wonderful.
call it a virtual support group, and we run it for anybody in the state every Tuesday evening.
Awesome. This is really good support. And I take it that being able to access the Zoom meeting will be available via the
It's on our
Michigan-
website.
the
Yep.
website?
It's Michigan. It's parkinsonsmi.org, and if we on the front page of our website, there's a little circle that says support groups. If they click on that, they'll see the Zoom link and how to access it.
Wonderful. Okay, Mary Sue, great work that Michigan Parkinson Foundation has been doing for close to 40 years, 38 years you mentioned. How can donors, right, partners, and those, benefactors, how can they make a meaningful or a substantive contribution to MPF? And if you could describe or articulate your biggest pitch or your biggest ask, what would it be, and how can folks help you?
Well, one program that I'm very, very proud of that I have not discussed is our in-home respite care
Yes.
program. We get a lot of phone calls from family members saying, my dad has Parkinson's, my mom has to go have her knee surgery.
Yeah.
I live out of town, and we don't have dad can't be home alone.
Yes.
We don't have anyone. Do you have somebody who can come and stay with my dad? Well, prior to 2018, no, we did not. We investigated this, and we developed a program that we contract home health care agencies like yours and we will pay
Yes.
for a home health care aide to go into the home, and we provide financial assistance to pay for up to 168 hours per family per year. And we're now contracting with 30 different agencies throughout the state of Michigan. In 2018, I think we budgeted $15,000 for this, and
Yes.
this year we're budgeting $223,000 for
Wow.
this. We
Wonderful.
took care of 123 families in 2020. So the need for this is growing.
Yes.
We had to hire a full-time social worker
Yes.
to administer the program. So if somebody wanted to make a real difference in someone's life,
Yes.
this is a fund that we are trying to grow. We have another equally important program. Dr. George mentioned how important exercise is.
Yes.
It's the one thing somebody with Parkinson's can do that will improve their quality of life. So to answer that need, we contract physical therapists who specialize in Parkinson's, and we are doing online exercise programs 6 days a week, Monday through Saturday. The only day we don't do it is Sunday. It's 10 a.m. every day, an hour-long program. The exercise programs emphasize dual task exercises, so maybe multitasking while you're exercising, so you're using your brain as well as your body, and that's helpful for people with Parkinson's, but it's expensive.
Absolutely.
It's expensive.
Yeah,
We are
sure.
contracting very talented, highly qualified physical therapists. So that would be another area that somebody wanted to fund that could make a real difference in someone's life.
Wonderful, Mary Sue. Yes, and in terms of home health care, our agency, we take care of patients all throughout Metro Detroit, and Detroit inner city does certainly have a serious need, for care as related to movement disorders, and we'll gladly work along with Michigan Parkinson Foundation, Mary Sue. So that's the home health piece, where home health care agencies can assist and help donors that want to contribute to those various funds and projects, highly skilled and highly qualified physical therapists. So the last one, in the event that you're not in the home health care space, or you're not a highly qualified physical therapist or occupational therapist or even speech therapist, as we talked about earlier, how could just the general person volunteer or add some support to your mission?
Well, we have an annual fundraiser. Thank you
Hey.
for asking. It is our Metro Detroit Parkinson Walk, and we are having it, it's scheduled this year, June 26th. It will be at Seaholm High School in
Okay.
Birmingham.
Okay.
We offer a 1-mile route and a 3-mile route, but it's a wonderful opportunity for people with Parkinson's and their families to come together, see that other families are dealing with the same things. We have an exercise expo, so we have 4 different areas where we have different healthcare professionals who are trained in Parkinson exercise classes, doing demonstrations, so we can really sell the exercise component at this
Absolutely.
event.
Wonderful.
And we hope that we can have a full-blown walk this year, in person.
Likewise. Oh, yes.
Fingers crossed,
That's
crossed
right.
that we
So-
can go back to having a live in-person walk this year.
Wonderful, Mary Sue, and trust American Advantage will be there. We'll
Well,
be
good.
there that
We
day to
hope
walk. Absolutely, to walk and to contribute. Mary Sue, you and your team are doing amazing work at the Michigan Parkinson Foundation, and we really thank you for joining us today on our show
Okay.
as we raise greater awareness to Parkinson's. Thank you so much, Mary Sue.
Thank you. Thank you for having me.